Hello, my name is Justin Clancy, and today I will be presenting on behalf of Morgan Carter and Kevin Davis. This presentation will entail our Tippecanoe County Health Department Accreditation Plan. Tippecanoe County is located in the west central portion of Indiana and home of our very own Purdue University. It has a population of roughly 196,000 with a demographic of 82% white, 6% black, 8% Asian, and 8% Hispanic. Precisely 91% of the population has a high school diploma, with 39% of that population earning at least a bachelor's degree. The median income is about $53,000 per year. The mission statement of TCHD is to enhance the health and welfare of Tippecanoe County through public health education, promotion, prevention, and the protection of public and environmental health. The TCHD is divided into 5 divisions. The first, birth and death certificates, assesses the current birth and death rate of the entire county. The second, nursing and immunizations, focuses on communicable and infectious disease control involving the Gateway to Hope syringe exchange program. Third is the environmental division. This division revolves around the safety of the surrounding environment of the community residents. This division analyzes testing and treatment of water for contaminations, septic tank inspections, housing issues, and body modification regulation. The fourth division, foods and public pools, is responsible for improving the quality of life for Tippecanoe County citizens by inspecting foods of retail restaurants and retail establishments, as well as being responsible for inspecting public pools within the county. Last but not least is the Emergency Preparedness Division, involving response time, resources and assets, utilities management, and safety and security. As of the most recent reportings, the current county's health improvement goals include participating in community efforts to improve mental health, decreasing the spread of disease from substance abuse, promoting access to exercise opportunities and healthy eating, decreasing tobacco use, increasing public health outreach and awareness programs, and providing resource guides to residents. The current accreditation process from the past 4 years began in January 2017. The TCHD planned an initial community health needs assessment, as well as a revision of the Community Health Improvement Plan. Later that year, the IU School of Public Health administered a survey determining pertinent health issues. It was in October 2018 the county established a Community Health Improvement Planning Committee, which implemented a new and improved plan released in 2019. This was followed by the hiring of a new administrator, Kala Hufstedler. Lastly, their most recent update was from March 2020, in which the COVID-19 pandemic hit, putting all accreditation proceedings on hold. The most recent health improvement plan acknowledged several areas of focus, one of which was substance abuse. Concerning statistics reported 1 in 3 high school seniors had used alcohol in the last 30 days. There was also reported 9 cases of possession and 202 cases of spice use, also known as synthetic marijuana. Other drugs reported included 11.2% of college students trying prescription drugs not prescribed to them, which resulted in 22 prescription drug-related deaths in 2015. In that same year, it was also noted 65 cases of heroin use accounted for 8% of all accidental overdoses. Another area of concern was chronic disease management. This area mainly pertained to hypertension, high cholesterol, anxiety, depression, and an assortment of chronic diseases related to various smoking statistics, which indicated a higher rate with lower income respondents. Relating to lower income respondents, another relevant area of focus is affordable housing. 85% of respondents noted homelessness as the greatest community need on the survey conducted in 2016. 22% of respondents reported an income of $40,000 or less, indicating a need for affordable housing. Additionally, Purdue itself noted student housing was potentially leading to overcrowding, essentially impacting the overall housing crisis of the county. The final area of focus the TCHD acknowledged was mental health care. As of 2016, the ratio of mental health providers per capita was 748 to 1. Approximately 85% of respondents indicated mental health care and child abuse prevention were the highest need in the county. As a means of competing with the demanding forces of health and extreme levels of change throughout the years, a balanced scorecard can be used as a management tool to assess and meet these challenges. The first of four components is the customer perspective. TCHD aims to increase the awareness of the community health issues as well as establishing high quality care with knowledgeable professionals. This will hopefully translate to equal opportunities across the county with equal access to health resources. The internal business component is based on internal evaluations. This includes service analysis, healthcare clinic evaluations, and a reflection of the efficiency and effectiveness of the proposed incentives. The third component, the innovation and learning perspective, involves collaborations amongst healthcare groups and partnerships with researchers and other health agencies. Once accounted for, the following three components are driven and controlled by the financial perspective, which is responsible for budget allocation across the county and a cost-benefit analysis of the healthcare changes made throughout the process. To stay on track of health improvement plan leading to potential accreditation status, an intervention strategy is used to set target goals with individual strategies. Overall, the TCHD noted 4 goals to focus on during their designated time period, noted in their most recent health improvement plan. The first 2 goals were aimed at decreasing substance abuse and improving mental health in the community. Their strategies included increasing awareness to at-risk populations, involving programs such as the Gateway to Hope, and increasing health providers for leadership and support. The third goal focused on decreasing chronic diseases and increasing physical activity. This goal reflected the chronic disease management area of focus and proposed solutions promoting healthy eating, physical activity, and an initiative to decrease smoking among the youth population. Lastly, the fourth goal was designed to promote a stronger presence in the community. This included initiating a social media presence, promoting community services and events, and even connecting Purdue University to host health fairs and offer health-related testing to students. Going forward, we believe continuing to increase community involvement will result in overall higher awareness and a better understanding of the relevant health concerns. This will hopefully bring awareness of access to resources, which will motivate public health officials to configure equitable distribution to healthcare services, healthy food options, and resources that promote physical activity. Lastly, we would recommend to incorporate assistant management strategy. Through research, health concerns can be evaluated and investigated to the point where, deemed if needed, policies can be implemented to better the community and increase healthy lifestyles. Thank you for your time. Please see the following resources used throughout this presentation.